Formthotics medical system is a patient-centric process of assessment, utilizing a clinician's expertise to quickly and effectively select, fit, and adjust Formthotics. The system is a comprehensive clinical method to improve lower limb function with custom-fitted Formthotics and includes the 6 tests, objective clinical tests, and the 6 steps to select, fit, and adjust Formthotics custom medical orthotics. The 6 steps are easy-to-follow steps to create total contact foot orthoses in your clinic, providing your patients neuromotor and mechanical facilitation for effective and pain-free propulsion. The 6 steps include the selection of the best Formthotics model, the thermoforming and fitting process, the physical adjustment of the orthotic by grinding and shaping, functional posting, in-shoe testing, and lastly, patient follow-up. By fitting a patient, the literature indicates that Formthotics have a neuromotor rehabilitation effect and do not cause muscle weakness. Careful selection and fitting results in customized patient management. Results include improvements in neuromotor facilitation, biomechanical support, functional stability, reduced pain, neuromuscular connections, better proprioception, improved balance, and increased comfort. Also, damaged tissues can be unloaded to allow healing and a more dynamic guidance created through gait. There are a number of considerations to make when selecting the right model of Formthotics. The selection decision needs to be centered at the patient. Which model will ensure their greatest patient compliance? Is the patient going to be comfortable? Is the selection going to support the patient and their goals? Do they need multiple pairs of Formthotics to support their different activities? Patient-specific considerations include pathology, including learnings from the 6 tests, activity level and type of activity, and footwear. Ideally, Formthotics will be available to you on-site so that if needed, you can fit the patient on their first visit. There are 4 commonly used models that are useful to have on hand. These would typically be used to treat most patients that visit the clinic. These are original dual medium or an alternative color, original dual medium perforated, original single medium with an alternative slightly firmer density foam, original single firm, original shock stop, and original dual hard. Formthotics offers a wide selection with a diverse range of foam densities and shapes. There are 23 models in total in the Formthotics medical product range. There is always a model to use for a particular patient and their footwear. Ensure the model selection suits the patient's commonly used footwear they wear day to day and in their sport. The patient might opt to have multiple pairs fitted to minimize the movement of Formthotics between shoes. This ensures the right level of support is placed in the right shoe and that Formthotics fit in the shoe. To fit the selected pair of Formthotics into the shoe, match the patient's existing shoe liner as a reference to determine whether trimming is required. Carefully trim at the distal end if required, and fit into the shoe after removing the shoe liner if present, ready for thermoforming. If the shoe liner can't be removed from the shoe, consider whether a thinner pair of Formthotics will fit into the shoe instead. Thermoforming involves Formthotics being heated inside the shoe so that Formthotics adapt to the internal shape of the shoe. Heat Formthotics to the molding temperature. At the correct temperature, they will feel different, more squishy. Once heated, fit the shoe with the Formthotics inside to the patient. If the shoe is a little loose-fitting around the ankle, the laces can be done up. Otherwise, this is not essential. Now, with wonderfully warm feet, ask the patient to stand. Formthotics are thermoformed, heat molded to the foot within the shoe. The ideal foot position is approximated by having the anterior knee aligned over the second toe and knees are slightly bent so that the body's weight is evenly distributed across the surface of Formthotics. The clinician forms the Formthotics up into the arch and heel area with both hands. The patient holds this position for approximately 30 seconds, completing the thermoforming process. There are 2 heating options for Formthotics. The Formthotics heating machine is an essential tool to help fit Formthotics for the best and fastest adaptation to the patient's new Formthotics. The Formthotics heating machine is just larger than a shoebox and compact to place in clinic. With the touch of a button, an automatic 3-minute heating cycle begins. The machine automatically stops when complete. The heating machine automatically heats to the perfect temperature every time. This ensures an even heat throughout Formthotics. More time can be spent with the patient. Why not make them a cup of coffee? A hairdryer can be used on occasions when not in the clinic or when only a small number of Formthotics are prescribed in the clinic. Formthotics provide a total contact to the bottom surface of the foot, providing exceptional comfort and optimal biomechanical support. Formthotics deliver on the mechanical theory by applying pressure to the sole of the foot, altering the posture and movement of the subtalar and other joints. This changes the posture and mechanical function of higher structures in the body. Thermoforming further enhances neuromotor facilitation, including proprioception. This increase in proprioception is achieved by the total contact created with the thermoforming process. This means there are more nerve endings in contact with the surface, increasing feedback from foot to brain, which heightens a patient's awareness of what the foot is doing. Research by Murley 2010 indicates that Formthotics have significant positive effects on balance, stability, and the EMG activity of various muscles. Experienced practitioners have offered some practical tips to assist a successful selection and fitting of Formthotics. These ideas include fitting Formthotics in the shoes and heating them out of view of the patient. This is quieter and more professional. Fitting the shoes and Formthotics to the patient promptly after heating. The patient feels the warm Formthotics and immediately feels the effective support. This is also the best moment for heat molding where the foam is at the optimal thermoforming temperature. If the Formthotics were not properly taken off the machine when completed, simply heat them again. Using the heating machine is important because Formthotics need to be heated to 85 degrees across the whole thickness of the material. Only a heating machine ensures this is done evenly. Using a hairdryer provides inconsistent and uneven heating across the surface and depth of the Formthotics, which reduces effectiveness. Don't ever use a heat gun to heat Formthotics or any other heating methods. The Formthotics foam can be overheated and melted, whereby it turns extremely hard permanently. Once fitted, ask the patient when walking around how it feels. Does it feel any different? Are they comfortable? Do they feel more stable? Valuable insight into how the patient is feeling can be gained from these questions. The Formthotics packaging is designed for the medical professional, not the patient, though if they must bring their old shoe liners home, the bag can be used to store these in. There is a small patient brochure in the packaging that can be given to the patient to review. And Formthotics can be reheated any number of times and further adjusted with wedges, or wedges can be removed altogether and the orthoses remolded as required. The break-in period is really important because the feet and legs need time to adapt to the new position the Formthotics are holding them in. If too much is changed too soon, the patient will take longer to adapt and may experience new pain that could have been easily avoided. This is particularly important when the patient is wearing Formthotics for the first time. The adjustment process also ensures the Formthotics mold properly to the undersurface of the foot. This means the practitioner can visually assess what postings are required where when the patient returns for their follow-up appointment. During this period, typically 3 to 7 days, there is increasing time and activity wearing Formthotics. There are lots of reasons to adjust Formthotics. It is a customization process where the orthoses are made to best fit the patient, facilitate better function, and provide the best support for their pathology to reduce their symptoms. The adjustments are usually placements of wedges or additions to the underside of Formthotics. The wedges may be applied medially or laterally. If, for example, the force to the foot is going to be to the medial side of the subtalar joint axis, this would allow the foot to become more supinated or reducing the amount of pronation. For wedges or forces that are applied to the foot, the patient's morphology and range of motion needs to be considered, as well as the suitability of the wedging or adjustment to the pathology of that patient. Wedges can be applied on the medial or the lateral side of the foot. Where the thickest portion of the wedge is applied to the underside of Formthotics is where the force is applied. For a medial rear foot wedge, apply the wedge with the thickest aspect to the medial side, tapering down to the thinnest part to the lateral side. By doing this, the rear foot is tilted. A medial force is applied to the subtalar joint axis, which is going to shift the subtalar joint axis laterally to reduce the pronation moment occurring at the rear foot. This can be used to stabilize someone who has excessive rear foot pronation. It may also be used to stabilize someone who has excessive rear foot pronation resulting in pain or dysfunction. For the lateral rear foot wedge, it is applied with the thick side to the lateral aspect of the rear foot and the thin side to the medial. The wedge will apply a lateral force to the subtalar joint and will medially deviate the subtalar joint axis and reduce the supination moment at the subtalar joint. This can be used to stabilize an excessively supinated rear foot. Consider whether or not the patient has the joint range motion available to be able to manage the force that is applied by the modification. Also, consider how the modification may affect other musculoskeletal systems within the kinetic chain. In the case of a medial rear foot wedge, if a patient has absolutely no manual supination on the supination resistance test, or no passive windlass activation, Jack's test, then the wedge may be unable to provide the level of force required and therefore does not achieve the goal of reducing the pronation moment within the foot itself. This may be seen when there is a pathology such as PTTD, and therefore the management plan may need to include an external shoe modification, or AFO, in conjunction with pronation control for a successful outcome. Note that applying a lateral wedge to a supinator who has no rear foot eversion available is unlikely to create the desired effect of reducing rear foot supination alone. In this instance, a heel raise to manage a forefoot equinus and to improve functional ankle dorsiflexion, along with an extension of the lateral wedge into the forefoot, good laterally structured footwear and shoe modification may all need to be considered to optimize the outcome. Heel raises may be used for both feet, bilaterally, to raise the heel up and reduce tension on the Achilles tendon. A heel raise may also be used unilaterally as interim measure to reduce a functional or anatomical leg length discrepancy. Heel raises may also be added to Formthotics to reduce the effect of a forefoot equinus and to improve functional ankle dorsiflexion in a patient with limited ankle range of motion. Wedges can be applied to the rear foot and/or forefoot on the lateral or medial side to change forces, as well as other additions in the forefoot area. Options for forefoot adjustment include medial forefoot wedge. Use the extended wedge and trim to the desired length, placing the thick part of the wedge to the medial side of Formthotics and the thin, beveled side to the lateral side. When adding a medial forefoot post, it is important to consider the effect this may have on the movement of the windlass mechanism. Lateral forefoot wedge. Use the extended wedge and trim to the desired length. Place the thick of the wedge to the lateral side of Formthotics and the thin, beveled side to the medial side. A lateral force will be provided to the forefoot. This is useful in a number of situations, for example, when the forefoot has a tendency to be laterally unstable. Where the forefoot morphologically is everted on the rear foot that gives the foot a tendency to sit in a supinated, highly arched, rigid position, such as pes cavis foot. To counteract or balance that foot, a lateral wedge would be added to Formthotics. Improvements in the forefoot stability test can be made with forefoot wedging. Metatarsal domes. Met domes are used to splay metatarsal joint spaces, relieving pressure. Met domes can aid clawed or retracted toes. To apply Met domes, apply to the undersurface of Formthotics near the center. An adhesive is applied between the metatarsal dome and the Formthotics. Formthotics have a self-adhesive option, creating on the top a diffuse metatarsal support. Positioning of metatarsal dome is always a little bit of a challenge as it varies so much from person to person and depends greatly on their pathology. A rheumatoid arthritis foot may require a broader, more diffuse, more posteriorly seated metatarsal dome. A neuroma patient or a patient with metatarsalgia neuritis issues may require a met dome placed more directly underneath the metatarsal heads themselves. Often, patients can guide best as to where they feel the most comfortable with their metatarsal dome on the underside. Other custom options include the metatarsal bar, kinetic wedge, Dudley extension, and Cluffy wedge. Know when to seek further advice. Orthotic modifications are complex. It would be good to refer to a biomechanically experienced podiatrist, particularly when considering use of one of the more advanced options. The combination of footwear and Formthotics work together to affect foot and limb function. This should always be checked during the fitting process. A good supportive shoe is needed for Formthotics to work best because it provides a nice, stable base, similar to the foundations of a house. Orthotic therapy may fail due to poorly worn, i.e., shoelaces not done up, or inconsistent footwear. Most of the 6 tests can be repeated in this step to evaluate the effectiveness of the Formthotics. Good functional in-shoe tests include the alignment test, balance tests, and gait tests. The improvement in symptoms should be verified by the patient, e.g., pain, dysfunction, balance. A patient's response to orthotics varies over time and is affected by other therapies. Formthotics should be checked and modified every 3 to 6 months ideally, no longer than 12-month intervals, depending on why the patient initially needed them. A review of modifications may be needed. This includes the addition or reduction of wedges and reforming Formthotics. Pending on use, Formthotics should last at least the life of the shoe they are fitted to. The end of therapy is when a patient is able to perform their daily activities without pain or unacceptable restrictions of mobility. Until this time, the patient needs your assistance and regular follow-up. For further information, visit formthotics.com/medical.